Over the past decade, autoimmunity has risen drastically. According to the CDC, 27 million Americans were diagnosed with autoimmunity. What's staggering about that is 79% are women.
Alessio Fasano, researcher at Harvard, has said that the onset of autoimmunity starts in the gut. And he still talks about environmental exposure, but that environment that you're exposed to is now when the gut becomes leaky.
These statistics are staggering. They're not going down, they're going up. They will continue to go up. We have a toxic environment. We have all kinds of issues. We're being under assault with different infections. We have to have better strategies.
Do not sit and think you are stuck in place. This is not a genetic disorder. It is largely environmental, and we can shift those environmental factors in your favor.
Welcome to Rethink My Health Radio Show, where each week we come to you from our studios in Atlanta, Georgia, talking about chronic disease, healthcare matters that matter most to you, your family, your loved ones, and as I say time and time again, they really do matter to us, the research scientists, the clinicians, the practitioners in the trenches, day in, day out, working with chronically ill patients and looking for solutions. This show is about education. We've been going through a series of Rethink My Health Radio show, talking about unique topics, whether it's cancer, whether it's obesity, diabetes, health-related chronic inflammation, thyroid issues. We're diving deep, and this show's about education. It's not here to replace medical advice from your practitioner, your physician. We're here to help you galvanize and rethink your health to take action. It all starts with that first step. So, today's show, we are going to be discussing autoimmunity. Over the past decade, autoimmunity has risen drastically. According to the CDC, 27 million Americans were diagnosed with autoimmunity. And here's what's staggering about that. And that's about 8 to 9% of our population. What's staggering about that is 79% are women. So we're going to talk a little bit about that. Some of the key areas of autoimmunity we're going to be looking at is rheumatoid arthritis. We're going to be looking at psoriasis. Type 1 diabetes is actually an autoimmune disease as well. Graves' disease, autoimmune thyroiditis, lupus, and celiac. Interestingly enough, those that are suffering or recently diagnosed with autoimmunity, one of these conditions, there are some health complications that they're seeing now. There's a extra risk of cardiovascular disease. And this is all according to the CDC research. The epidemiologists have been studying this as well. So Dr. Burdette, welcome to the show. You've been coming on with me for the past 6-7 weeks. We're excited to go through a series in 2026. And I really want to educate our listeners right now on getting to the root cause. First-time listeners, Rethink My Health is sponsored by Progressive Medical. Progressive Medical has been a forward leader on functional integrative medicine, and integrative medicine is just good medicine. Dr. Burdette.
Yes.
Getting to these statistics, 27 million Americans diagnosed with autoimmunity, well over 79% are women. So let's just talk about why. Let's get right into the root causes, and I'm just going to throw out a couple of right here.
Yeah.
The research I've done, one of the number one reasons, and let's put genetic predisposition aside for just a second, because that could play a role. I want to talk about some of the new research about environmental triggers and microbiome. Let's start with those two first of all. How does that correlate with autoimmunity? And before you even answer that question, let's give an overview on autoimmune disease, just generality for the public.
Yeah, absolutely. So autoimmune means that your body is attacking itself. And so this is a classification of pathology or disease conditions that we've seen radically escalate in the past 40 years. And when you look at the literature, what is discussed is that the increase is too fast to be explained by genetic drift. This is not some genetic change. And the research is very clear that the reason that this is occurring is because of different environmental assaults. And so that is agreed upon. And very few times do we have things that are agreed upon in the scientific data. So when we are full on saying that it's this environmental assault that's caused our immune system to go awry, we really should begin to take note of that. Now, you mentioned a couple other things, that women are staggeringly 79% more at risk than men. And a stat that really blew my mind is to see that in kids, in the demographic from 16 to 22, we are seeing a doubling of rates of autoimmunity. And that is really impressively bad to me, because usually we think of an autoimmune condition as something that we get when we're older. And, that would explain to some degree why we see more prevalence in women. For example, we start to spike with autoimmunity postmenopausally, changes in hormones. And so we can see some of those differences, and that makes sense. But to get a confused immune system, it usually actually takes time. So what happens in general is that when we're younger, we make really good attacks to different viruses and bugs that we come in contact with. Our armory is really strong and accurate. And those are called antibodies. Those are the things that we make to attack a virus or a bug. But as we age, we get not as good at making this armory against bugs, and our machinery gets more sloppy, and the antibodies, or what we make, our weapons that the immune system is making, become more shoddy. And because of that, they don't attack the bug directly. They get confused. Amino acids, proteins in the bug look enough like our own tissue, and that antibody that we've supposedly made to attack an infection cross-reacts, attacks our own system. So in general, that happens when we age. So to see this in a much younger population is disturbing. And again, it points to the environmental influence, but I want to get right in there and say environmental influence is not only what you breathe in, what's in the air, what's in the water, what's in the plants that we eat. Environmental influence has to do with your own body as well, and how well things get in. One of the leading experts in leaky gut or gut-based permeability, and Alessio Fasano, researcher at Harvard, has said that the onset of autoimmunity starts in the gut. And he still talks about environmental exposure, but that environment that you're exposed to is now when the gut becomes leaky. So now I gave you that description of the immune system gets confused, it thinks it's attacking a bug, it's really attacking you. Well, when your gut becomes leaky, many things flood into your system that shouldn't be there. Bigger bits of food, bigger bits of bug, and the immune system is overwhelmed, it's confused, it begins to attack, but it's not specific, cross-reacts, attacks your own tissue, and autoimmunity is born.
And that's a great explanation, attacking. And our immune system was given to us by our maker to definitely attack pathogens, there's no doubt about it. So you have two immune systems, you have intracellular and you have outside the cell, which has a memory. So this is where the cross-reaction happens and the confusion happens. So it's really all about balance. And I remember the father of functional medicine, Dr. Jeffrey Bland, when I went to one of the first conferences, probably almost 27, 30 years ago. And it was a very interesting concept where he brought this concept about autoimmunity. He talked about a seesaw, right? And when you're out of balance, you have too much of one area or too much of the area, the whole body goes out of balance. And this is the beginning stages. And I do believe that we're seeing an increase of autoimmunity because of the environmental changes, because of the assault of these chemicals. Now, I want to make myself very clear. If you're having an advanced chronic disease, and some of the advanced autoimmunity is multiple sclerosis. That is also an autoimmunity as well. And some of these areas, you're just not going to be able to do a detox plan and reverse it, okay? You have to correct the problem.
Yes.
Conventional medicine is using some very strong medications, which could be appropriate short term, but they have long-term consequences. You don't want to be on steroids for the rest of your life. Sometimes physicians have no choice because they have no other options. And that's why that these big medications do have serious side effects. You use them when it's necessary. You listen to your physician. But if you have that curious mind, if you are inquisitive and you really want to think outside the box, this is where functional medicine can play a role in filling into the gaps. And it's more than just managing those particular symptoms. And we believe as functional integrative doctors that common denominator, okay, is gut dysbiosis when it comes to autoimmunity. If you focus on gut health and you mitigate some of these other factors, whether it's a nutritional deficiency, where it's hormonal imbalances, whether it's a chronic infection, absolutely, we believe that your body can heal. I don't want to use the word curative because only the body can cure itself, but we've seen some great advancements just by working on the gut. Okay, so I'm glad that you mentioned that, Dr. Burdette. So environmental triggers, gut microbiome. I also have some research study here on chronic infections and toxic exposures. How else do these factors, really about chronic infections, there has been a lot of correlation with certain viruses. What have you seen in the research when it comes to viruses and other infections with autoimmunity?
Absolutely, and you mentioned recent advances, and I think that is so true. We can look to who won the Nobel Prize in Medicine this year, and it was around discoveries in the immune system that are directly related to autoimmunity. And one of the big discoveries was a type of immune cell, a white blood cell, called a Treg cell. And they were all excited about this discovery, and in the name, Treg, regulate. So this is what functional medicine does. So if we're approaching autoimmunity from a conventional standpoint, the general approach is your immune system is out of whack, it's too high, it's attacking your tissue, let's suppress it. And so various medications can be utilized, maybe low-dose chemotherapeutics get used because chemotherapy is very good at killing off the immune system. So those are a classification of drugs that get used. Biologics, things that block inflammation in the immune system, and then various anti-inflammatories like steroids, things like prednisone, shut the immune system down, but also damage your system, particularly connective tissue, and keep you up at night. I want to talk more about that in a second. But so in general, standard of care approach, your immune system's run away, suppress it one way or another. Functional medicine approach says there are different parts of the immune system. There are parts that fight, and these parts that fight will get upregulated by that virus that you just mentioned. They'll get upregulated even by toxicants in the environment that we've talked about. But for example, when you work on a leaky gut, one of the things that does, not only does it build a barrier, so you're putting a wall between things flooding in and confusing your immune system, but it also increases those same cells, those same Treg cells. And they were all excited, and as they should be, winning this Nobel Prize. But I was thinking, we've been working to do things to increase Treg cells. They're not medications, but Treg cells for decades now. We know that treating a leaky gut increases Treg cells, the exact cell that balances the immune system. It doesn't suppress it. It doesn't augment it. It puts it back in balance. Leaky gut treatments do that. A lot of our natural immune treatments do that. We have botanicals that will fight a virus and increase your immune system, but then they send signals to come back around and turn on these Treg cells to know when to calm the immune system back down again, because you want both. You want an immune system that can fight, but you want an immune system that doesn't fight your own body. And so the wisdom of functional medicine balances this immune function. This Nobel Prize award, these Treg cells, we've been thinking about ways to increase those those for years. It's not necessarily drugs, but it's things like Treat Your Gut. It's things like vitamin A and vitamin D and omega-3 fatty acids, but working with a clinician in a functional medicine space that can teach you which one of those nutrients is most important for you. What should you do to treat your leaky gut? And that's where this real magic happens in terms of waking up the body's wisdom, not suppressing the immune system, not augmenting it, but working with it as a whole to put it in balance.
It's all about balance, and that's why I mentioned Dr. Bland, who's the father of functional medicine, and he's done a lot of research, and he gives a great example in regards to using a seesaw, where you're sitting on a seesaw. It could be one or the other. And certainly there's a time for the immune system to attack, and there's a time for the immune system to come back. Conventionally speaking, in fairness to these rheumatologists, they're doing what they were taught. And basically, the immune system's overdrive, let's just shut it down. Now, short term, that could be appropriate.
Could be.
The long-term consequences of that could be devastating. There are numerous correlations with some of these medications long-term where you're susceptible to other serious diseases such as cancer. Mm-hmm. We've seen it before. And that's why it's really, really important that we have to do a better job on educating our practitioners and our physicians conventionally to also look at the new research coming out when it comes to these medications and also some of the root causes of this. And that's one of the reasons why functional integrative doctors are not going to just settle, hey, we just got to use this medication. Hey, we have to really find out what's going on. Mm-hmm. Now, one of the areas that patients are probably wondering, how long does it take to get better? Well, that really depends on your test results. If you don't test, you're just guess. So I want to jump right into some of these areas of concerns, Dr. Burdette, when it comes to testing. So we know chronic infections, we know stress and lifestyles, and toxic exposure. But before I go into the testing for a minute, we kind of skipped over the stress and lifestyle factors. How does stress play a role? Because typically what happens when the body goes through stress, it affects glucose metabolism. Mm-hmm. It affects something called cortisol. So how does stress, which affect these two hormones, insulin resistance, could lead to insulin resistance, and cortisol, how does that affect autoimmunity?
Yeah, so our white blood cells, our immune cells, respond to stress in a way that you might think a single cell would. They say, oh my gosh, here is a stress hormone. That means I need to get active, I need to divide, I need to get more aggressive. And so stress hormones can push us into more immune overdrive. They can increase types of T cells or immune cells that bolster inflammation while suppressing that ability to bring the immune system back in balance. That cortisol that you mentioned is interesting because it can have a similar effect when it's high or when it's low. We want it normal, in the middle, or behaving normally throughout the day, I should say, because cortisol should peak in the morning so we feel like getting out of bed and slowly decrease. And so that good natural cortisol that peaks in the morning acts as an anti-inflammatory to keep our immune system in balance in the right amounts. But once it starts to go into overdrive, that can kick your immune system into an overdrive as well, that can confuse it, and you start to attack your own system. So I think that this is really the important message, is there's all these things that can contribute, but an autoimmune condition is not largely a genetic condition. You might have a genetic predisposition, but what causes those genetics to express themselves, what causes those to turn on more aggressively, because you weren't born with rheumatoid arthritis, you weren't born with Crohn's disease. These things tend to happen later in life when something happened to your immune system, when something told your genetics to change how they're expressing themselves. So now, it's not largely a genetic condition, it's largely environmental factors washing over your genetics. How permeable is your gut? How tanked is your system that responds to stress? Those are your adrenals. What is your nutrient level like? And what are we doing to balance your immune system? And so when we put those environmental factors back in place, it calms down this genetic expression, calming down autoimmunity. And I want to speak for 1 second about viruses, which you mentioned, which I think are just such an important piece. Whether or not it's a virus or bacteria, even sometimes a parasite, these things trigger your immune system. And even if the infection goes away, the immune system stays upregulated. It stays confused by what happened. And so now we have to work to balance that immune system back out again. And so treating some of these chronic infections, that can, for some people, be the environmental trigger. Some people it's pollution in the air. Some people it's a virus you got. Some people it's something that happened to your gut that caused it to be more permeable. All of those things allow things from the environment to flood into your system and to excite your immune system. But again, it's not genetic. It's environmental, and we can remove those environmental triggers and help put the immune system back in balance. So if you're sitting there thinking, there's nothing I can do about this, did you know in rheumatoid arthritis patients, an autoimmune condition, if I biopsy the inside of the joint where the inflammation is, you can find remnants of little bits of viruses, something called Epstein-Barr virus. You can find remnants of something called LPS, bacteria that comes from the gut. You can even find antibodies that are cross-reacting and attacking your tissue that match the antibodies in your bloodstream that are attacking foods that you're eating when your immune system gets confused by foods. We can directly see this right down to the tissue. It's not a gene, it's the environmental trigger.
Absolutely. And it's so important for our listeners out there that are suffering with autoimmunity. If you have a loved one, a family member, someone, there's no doubt that this is a chronic condition. It's lifetime, okay? How do you manage that? You got a couple options. You can stay on the traditional path, which is medication, and that could be appropriate short term. Our philosophy is entrenched on making your terrain better. You have options, and that's what I want to talk about. Looking at triggers, infection, gut dysbiosis, environmental toxicity. All of these things play a factor. So you have to look at this at phases. And, you know, I've seen many, many patients come in over the years at Progressive Medical and talking to other colleagues across the country, going to these different seminars. And, you know, a lot of them are talking about patients are coming in, they have these other autoimmunities, and they end up getting these more devastating diseases, whether it's cancer, whether it's some other advanced diseases. And a lot of the times, one of the common denominators they were just on a plethora of medications to shut down the immune system. Yeah, listen, nobody wants to be in pain, especially when it comes to rheumatoid arthritis. I absolutely understand that. And obviously, you don't want a flare-up. We're not talking about a flare-up here. That could be appropriate short-term. The problem is short-term becomes long-term, and there's no end game, there's no strategy, and it's really important to do the testing. So let's go back to the original question I had. By the way, first-time listeners, we welcome you. Our loyal listeners, we are so glad here. This is Rethink My Health. We're tackling on very challenging topics. There's no easy solution for autoimmunity. It is a complex, but there is hope. And with that hope, you got to think outside the box sometimes. And yeah, it's a journey. And you have to look at a team. You need your medical doctor, of course, and you can go to a functional doctor, a naturopath, a nutritionist, a health coach, mid-level practitioner. Just find a team that's going to work for you. I encourage our listeners out there that have an autoimmune disease to ask your practitioner, hey, can you recheck me for some viruses? Hey, can you do some further testing for me? Can you talk about the microbiome? If they don't have the answer, find somebody that does. There's many, many practitioners out there that are practicing this way. And when we started over 27 years ago, there was very few, but I'm glad to say that more Americans are asking for this type of medicine. Okay, Dr. Burdette, we only got a couple minutes before the break. So I want to get right into the diagnostics. And conventionally, physicians look for an ANA. I think that's important to look for an ANA. That actually is kind of a trigger, and that could lead to other things. But that's not a standalone test.
No, that just tells you your immune system is pointed in a direction. But now what are you going to do to shift the direction? What was the cause of that in the first place? And so one of my go-to tests for this, and we'll talk more about this after the break, is something that we call a gut oxidative stress test at Progressive Medical. And the reason that's so important is it looks at the two major reasons that you have autoimmunity. Is the gut permeable and things are leaking in, confusing the immune system? And do you have too many free radicals? Because free radicals really ramp up your immune system and say, oh my gosh, there must be something here I need to fight. And so when we can see you have too many free radicals, too much oxidative stress, that gives us another avenue to tone down the immune system. And those two ways you do that, you work on the gut and detox. So you can see why it's so important to work with an integrative physician.
Absolutely, there's no doubt about it. Hey, this is Rethink My Health Radio Show. This is Dr. Gez Agolli, your host, joined with Dr. Cheryl Burdette, getting to the root cause. If you're suffering with autoimmunity, if you know a loved one, or if you have really mysterious symptoms, we encourage you to go to your doctor. We encourage you to get some testing done. If your ANA is elevated, look at your options. 27 million Americans diagnosed according to CDC. 79% of those are women. These statistics are staggering. They're not going down, they're going up. They will continue to go up. We have a toxic environment. We have all kinds of issues. We're being under assault with different infections. We have to have better strategies, and you have to be able to determine what works for you. And there's many paths to wellness and health. And that's why at Rethink My Health, we are here to educate you, to hopefully galvanize you to take action for your health. 2026 could be your year, and it's a step-by-step process. When we get back after the break, we're going to talk more about testing. We're going to talk more about treatment options, and we're going to talk more about how you can navigate through this. It doesn't matter whether you have thyroiditis, whether you have rheumatoid arthritis, lupus, celiac, Graves' disease, psoriasis. There are common denominators. Yes, these are different diseases. Yes, there's a genetic component, but it's the expression of those genes, it's the epigenetics, and your lifestyle, your choices can make a huge impact on how you navigate, and you can have less and less flare-ups, and you can continue to get well and have a thriving, long life that could be pain-free, and you have more energy. And that's what our goal is at Progressive Medical and Rethink My Health Radio Show, is to give you options, not to replace integrative medicine, to complete it. That's what integrative medicine is, getting to the root cause, a partnership. This is Rethink My Health Radio Show. We'll be back in a minute. Welcome back to Rethink My Health Radio Show. Each week we're coming to you talking about unique topics. Today's topic, autoimmunity. We're talking about the different autoimmunity, we're talking about different diagnostics and different therapies. I want to jump right into the diagnostics. So, Dr. Burdette, we talked a little bit about the ANA, which is an important test. That'll tell you what's going on with the immune function. But there are so many other tests, and I think it's really, really important that you go to your physician and you ask for these particular tests. If you don't get them, find another practitioner that can do that. So I think the first one, let's just talk about gut health for just a second.
Yes.
We had a previous show devoted to gut health, but this is very, very specific for autoimmunity. So a couple tests that we believe will be a game changer for a lot of you. One of them is called an intestinal barrier, and it looks at numerous markers. One of them is called zonulin, and zonulin is one of those markers that when it's elevated, the gut becomes permeable. So what ends up happening when the gut becomes permeable? Just imagine your gut is similar to a bathtub. If the bathtub has tiny, tiny holes and you have water leaking, what's going to happen? Water's going to go on the floor. And what do you have to do? You have to seal up the bottom of the bathtub, right? The same thing with the gut. The gut becomes permeable. And when you have these undigested protein particles leaking into the bloodstream, your immune system sees that as a foreign invader. Okay, so it's a blood test, intestinal barrier. Dr. Burdette, you're instrumental in developing this test. Why did you pick all these markers? I know there's zonulin, you got something called histamine, You've got something called diamine oxidase, which is an enzyme. And then you've got these endotoxins.
Yes.
All right. You're looking for these antibodies. So why did you choose that?
Yeah, because I think that when we get right down to the heart of the research, we can see that these markers track with the root cause of autoimmunity. Sure, absolutely. Do an ANA, figure out what type of autoimmune condition you have, but then let's also figure out what triggered that in the first place. And so a marker called zonulin is one of the markers that's on the gut oxidative stress that I think is imperative for people with autoimmunity to look at. And let's even say we happen to get lucky and you don't even have a diagnosis of autoimmunity, but maybe you went in and it was suspected, and that marker that we keep talking about, that ANA, came back positive. So that checks the first box. Then they do a further workup to see which autoimmune disease you actually have. For some people, nothing else comes back positive. They're essentially told, well, we don't really know, watch and wait. So I would suggest, rather than watch and wait, let's watch and prevent. And the research really says that that is a possibility. So, for example, there is a marker that we look at called zonulin, and it tells the gut to open up. Think about zonulin as a key that you put in the keyhole, and that is what opens up that permeability. And so this will happen in a gut that's been exposed to the wrong type of bacteria, where you have dysbiosis, those endotoxins that Dr. Agolli just talked about, and you can have these things in your gut and not even know it. You don't have to have pain, you don't have to have diarrhea or cramping or even a gut-based condition. They're just sitting there and they're creating these inflammatory mediators that get absorbed and then wash over the genetics till eventually the gene says, yep, we're going to turn this into an autoimmune condition in the body. And so zonulin tells, that's the key in the hole. It opens up the door. So zonulin goes up before the onset of autoimmunity. So if we can track it on the way up, we can prevent it. But that's okay. You already have the diagnosis. It doesn't mean you're stuck in place. We can look at where your zonulin is at, and if that's elevated, we know your gut is permeable. We know things are flooding in to confuse the immune system. And so now we have therapies to decrease a leaky gut, from peptides to nutritional therapies. And as that zonulin comes down, your barrier goes back in place. Think of it as a fort and the wall and closing the door. Nothing can invade and confuse your immune system anymore. So we can measure zonulin. We can see how permeable your gut is. We can treat it. And when that comes into normal range, we know that we've taken a burden off the immune system. It's not going to be flared in the same way. And that correlates with symptom change as well. So seeing these symptoms get better, not because you're suppressing your immune system, but because you're putting it back in balance.
And you're not only putting it back in balance, you're correcting it. You're correcting it. And one of the great things about that particular test is that if your autoimmunity is uncontrolled right now, and we find out there's imbalances, that'll give your practitioner a gauge how long you should be doing these treatments. For example, a lot of times patients walk into a functional practitioner and they put them on a regimen and there's no end game. Well, how long am I doing this? What am I doing this for? And there's certain things you got to cycle in, cycle out. And I believe from a patient compliance perspective that you should have a conversation and say, I need you to do this for 3 months, 6 months, whatever the case is, okay? There's certain things that obviously are lifetime. There's certain things that are foundational. It's like eating particular food. We are going to be eating food for the rest of our life. And a lot of these nutrients are food. There are certain strategies. Should you do fasting? Should you not do fasting? How long? Women react differently than men when it comes to fasting. What's my toxic body overload burden? There's a lot of factors there. So that's why when you test and you look at these markers and you have a practitioner that's trained properly, they can determine the treatment regimen and how to counsel you and coach you. Because it's not just getting a test. It's how this test is interpreted. It's how this test is used properly. I've had many people over my career. I've been talking and coaching and helping practitioners, and they literally, you'll have two different practitioners look at the exact same test, and they have the exact same training, and one said there's no problem, the other one can really see trends, and the one that really digs deeper is a much better practitioner, and they're proactive. Other ones, sometimes you can overtreat as well. you can't do everything simultaneously for the body. So you have to start off. And our philosophy has always been on root cause, looking for inflammatory markers, looking for inflammation, and quelching that inflammation and finding out, is it an infection? All right, so that's the intestinal barrier. I want to jump right into food. Hippocrates, the father of all medicine, talks about let your medicine be your food and your food be your medicine. That sounds like a cliche, but it's actually true. A lot of medications do come from plant sources anyway. It's just synthesized by chemists. But how would a food reaction, a food intolerance, or sensitivity cause haywire in the immune system?
And this is such an important area to look at. Is your body confused by foods? Is it making one of those antibodies, that armor that it thinks it's making to attack a bug, but is it confused and making it to a food? And this can be a major reason for autoimmunity. And so these can be healthy foods, things that we should get in our diet, even broccoli or chicken or spinach. We can have sensitivities to these things. So what does that mean? Well, it's back to that environmental trigger. But again, in this case, the environmental trigger is the leaky gut. So now you're doing your best. You've noticed more joint pain, a little more fatigue, because this is how autoimmunity starts. You'll start to notice pain throughout the body and more fatigue. And it can be kind of vague and nonspecific. And so it can get missed for a while. But if that's going on, take note, because again, it doesn't mean that you have to be on medications the rest of your life. We can fix it. We can retrain your immune system. So this is one of the ways we do that, through diet. So is your gut leaky? If that door is open, now you eat foods. A good, healthy, non-permeable gut where the door is closed has enzymes in the lining, and so it breaks down your foods, and it breaks them down into tiny, tiny little bits that are nutrients that the body uses. I want this, I'll take this in. But if the gut is leaky, those bits of food flood in intact, whatever you're eating, broccoli, spinach, chicken, things that are healthy. Now you make these antibodies to attack the food, but the food looks similar enough to your tissue that it cross-reacts and attacks the tissue as well. I mentioned, like for example, in something like rheumatoid arthritis, if I look at the fluid in the joint, it will and I measure antibodies to foods in your blood. The same antibodies to foods in your blood will be in that joint tissue, showing the cross-reactivity, showing the damage that they can do. And so when we get rid of the food that's flooding in, that's the first way it calms down the immune system. Then it allows the barrier to heal. When the barrier is intact, that also primes the rest of the body's immune system to say, hey, our front line of defense is back where it should be. We can calm down. We don't have to be overactive. And so those Treg cells go up again. So the ones that I was mentioning at the beginning of the show that regulate the immune system. They keep your immune system ready to fight a bug, so you're not immune suppressed, but they keep you regulated so you don't run away. So you get rid of those foods that create inflammation. You get rid of antibodies that attack your tissue. But that tells your gut, things are good. And that causes Treg cells to rise to the top, those same cells that won a Nobel Prize for their work with autoimmunity this year.
That's impressive about the Nobel Prize, by the way, and I'm glad that immunologists won it, because it's a very challenging topic altogether. There's so many different functions. Okay, it's really important for our listeners to understand. By the way, this is Rethink My Health Radio show. This show is about education. It's here to assist you as you navigate these different complex chronic advanced conditions. I think it's important. If you've been to your physician or an allergist, allergists do a great job when it comes to environmental testing. And they do test for foods, but they only test for something called IgE. Dr. Burdette, it's really important that we address this issue, because many patients go, oh, I'm fine, no allergies, I'm good. So why should a patient think outside the box and do a delayed sensitivity? Let's educate them the difference, because I think it's really important to discuss that.
Yeah, so we are familiar with allergies. We know you eat a strawberry, your lips swell, or maybe somebody drinks milk and they hurt from that. So we understand what an allergy is. However, unfortunately, if somebody knows that they're having distress from food, they should also, and an autoimmune condition for sure, they should be looking at sensitivities. And these are not life-threatening events. You don't go into anaphylactic shock. You don't need an EpiPen. You're not going to swell so much that you can't breathe. But these IgG antibodies to foods, well, they precipitate into your body and they attack your tissue, driving an autoimmune condition. But in addition to that, it's what's called a feed forward, because once you start making IgG antibodies to foods, those IgG antibodies themselves have been shown to make the gut more permeable. So now you become more permeable, more foods, more autoimmunity. Now I need more things to suppress the immune system. But you suppress the immune system, and that can send you in a completely wrong direction. And let's think about this from another angle. So get rid of the food that's triggering the immune system, but things in the gut, bugs, that's another big thing that triggers the immune system. So let's say you had an overgrowth of a bug in the gut, a bacteria, or maybe you had some chronic virus, and you made these antibodies, and now they're cross-reacting and attacking your tissue. You've got an autoimmune condition. Now you go into standard of care, they put you on a drug that suppresses the immune system. Short term, that does get rid of the symptom, because you suppress the immune system to make less antibodies to attack this bug. But now you've suppressed the immune system, so you get more bugs, more antibodies, more cross-reactivity, and now you need more drugs to suppress the immune system. Well, those same drugs that suppress the immune system can also damage your tissue or can cause you to have an increased risk of various cancers. And so it's, again, this is why people tend to get worse and worse and worse, or need more and more and more meds rather than better and better. So think about if we can approach this from a functional medicine perspective, where we're going to balance the immune function. We're not going to suppress it. We're not going to put it into overdrive. And when we break it down into the two major things that, well, I'm going to say three major things that can do that. Foods that you're eating, your immune system's confused, bugs that you've encountered either in your gut or chronic infections, and toxins from the environment that will overly stimulate your immune system. And when you deal with those areas, sure, we're not going to say cure, but I like to say permanent remission. Can I say permanent remission?
Yes, and the body goes back into homeostasis, which I totally agree. So that's a very interesting approach, and I totally agree with you on that, and that is a functional approach. It's kind of a vicious cycle. Mm-hmm. You got autoimmunity, and you get a flare-up, and you go to your traditional doctor, they're going to increase your meds, and then that makes you more susceptible if it's an infection at that particular time. And that's where the balancing act comes in. Mm-hmm. That's why I like to reference functional medicine, Dr. Jeffrey Bland, who talked about that seesaw effect with the body. There's a time where you have to be higher attacking, and there's another time where the immune system, and we call it Th1, Th2 balancing. And here's the issue. It's like anything else. Life is all about balance. And that's why when you take a step back, if you are diagnosed, if you are one of the 27 million Americans out there with an autoimmune disease, and you've not done any of this testing, I want you to set up an appointment with your physician and ask them about this testing. If they will not do the testing, I would talk to a functional integrative doctor. There's some great doctors, whether you're here in Atlanta, come to Progressive Medical, all over the country. You're going to find a good practitioner out there. More and more doctors are being trained in functional integrative medicine. Okay, so we talked about some of the testing. We talked about the adrenals. We talked about gut health. We talked about environmental toxicity. Let's talk a little bit about some lifestyle modifications. Let's say these results get back and their gut has been treated, they're on track. I want to talk about some of these lifestyle factors that we need to focus on, and also some key nutritional supplements that have been researched. And there are a couple of medications I want to mention out there. I'm throwing a lot out there, Dr. Burdette, but I want to talk about LDN as well. Low dose naltrexone is a medication that we've seen some great benefit.
Absolutely.
When it comes to balancing, modulating that immune system, which is the key, right? Not too much, not too little. It's all in balance. So let's get right into that. Got the testing out of the way. What are some of the go-to supplements? And just give me a very quick reference. scientific reference why.
Yes, absolutely. And so before you start to get online and look for a bottle of this, a bottle of that, I'm just going to already confess to you that the answer is not in per se any singular supplement bottle. It's in that individualization of what's happening in your system. And so is it that your gut is more permeable? Is it that your adrenals aren't controlling stress hormones that can trigger the immune system? Is it that you're overly toxic and that's triggering the immune system? Is it that you've had a chronic infection that's doing it? So you could say this is the best supplement for autoimmunity, but does it treat the cause of your autoimmunity? So first and foremost is know what is at the root cause of your body, work with somebody in the functional medicine space to get started in these areas. But from there, absolutely, there's some go-tos that we're going to look at for autoimmunity. And so for me, one of the things that I really like over at Progressive NutriCare is something called Immune Max, and it is an immunoglobulin. And immunoglobulin are things that we make naturally. So if you are breastfeeding a kiddo, one of the major things that you're passing on is your immune system. And we're all pretty aware of that. This is something that we do to protect baby. And the way that you're doing that, what you're passing are these immunoglobulins. Now we also know that the data with breastfeeding says if you can do it, and there are times where people can't. This is not a shame or blame, but we do know that there's positive research with breastfeeding that shows that you have less risk of autoimmunity in the future, but you also have less risk of infections. So you're not going to get sick, so your immune system's not suppressed, but you're also not going to get autoimmunity, or you have less of a chance. It's less runaway autoimmune system. So we see right off the bat that Mother Nature gave us this immune modulating formula to keep the immune system in balance, and that's breast milk. So we can learn from that. The major thing in the breast milk that modulates the immune function are those immunoglobulins, and they're oral sources of those. They can come from serum, so different bovine sources, but we can see egg-based sources or even colostrum-based sources. But those immunoglobulins help the gut to be less leaky and send a signal to some of our immune cells to say, hey, don't be overreactive. Let's hold the line. Those are your Treg cells. Let's stay balanced, not overreactive, but we're also not on break either. So that's one of my go-tos, but I have to have the testing to know that's the right supplement for that person. I'm going to be looking at their zonulin. I'm going to be looking at their gut ox stress test. So if you have an autoimmune condition, go look up gut ox stress, look at Precision Point Diagnostics, reach out to them. They can help you find a practitioner that's doing this style of testing. But really, if I could have that test done for anybody with autoimmune condition, I feel like there's so much of this that we could really put the genie back in the bottle, put the symptoms back in the bottle, and work towards that remission.
Immunoglobulins are fantastic, and that definitely is a game changer. What's really interesting, you mentioned about breastfeeding, which we're big advocates for. But it's interesting, a lot of people may not know this, but when a child's born, the first 6 months, you've got something called maternal IgG. So that baby is covered for the first 6 months, but after that, they're not.
Yeah.
And if you're not breastfeeding, you got to also look. We're seeing a lot of sick kiddos out there. And we do have someone at Progressive Medical that specializes in pediatrics, Melanie Wardle, and she does a great job on the testing and also the treatment. Okay, so totally agree with you on immunoglobulins. Vitamin D has a plethora of research. And a lot of people think, first of all, wait a minute, vitamin D, how's that going to affect my autoimmunity? Well, first of all, vitamin D is actually a prohormone, right? It's a fat-soluble prohormone. But what's interesting is that there's a lot of research that talks about modulating the immune system, hundreds and hundreds of different receptors. I listened to a study, actually a talk, and he was referencing the studies like almost 2,000 different receptor sites, and one of them was CD4 that goes to CD8, and then T cells, right? So you kind of need that as a precursor. So vitamin D, we believe, and once again, vitamin D has been well researched and talked about, but people don't think about it for autoimmunity as well. But talking about medication, we only got a few minutes, and a lot of practitioners have been researching with LDN. What have you seen in the research? Low dose naltrexone.
Yes, searching out a practitioner that will work with you in this area is phenomenal. So naltrexone, yes, it's a pharmaceutical, but the focus on that LD, that low dose in front of it. And so this is, again, where sometimes standard of care can miss things, because the idea is if a little bit of a drug is good, more is better, more is better, more is better. But that's how we get side effects. And it turns out you can have some really unique mechanisms of actions when you dose things to a very low side versus a high. So and it can really change what's happening. So what we've seen with LDN, low dose naltrexone, is that there are very few side effects from it. You're using a fraction of the dose that's been looked at that might have some level of side effects, and it's a go-to for balancing the immune system, really helping with things like joint pain, getting into sleep, and really very, very easy for the body to receive. And again, we want to surround the person in a whole person approach. Like even getting your hormone levels looked at can help with autoimmunity.
Absolutely.
We talked about how women can have an increased incidence, and that happens to be postmenopausal. Get your hormones done. Not only is that going to make you not wrinkle, but the same connective tissue in your face is in your joints that those antibodies try to attack. So surround the person, build the person.
That's a great point. Thank you, Dr. Burdette. And you know, anecdotally, I've seen a lot of practitioners use low dose naltrexone for MS, and it doesn't go into remission, but it really makes a big deal, and it's really interesting. So if you've not heard about it, research LDN. Hey, this is Rethink My Health. We're talking about autoimmune conditions. This is your year. This is your temple. You need to take care of your own temple. You need to think outside the box. You need to look at all these different strategies. Get to a practitioner to do the testing first, and then look at these particular strategies. There is hope for autoimmunity. There is hope, and there's a path to wellness. We've seen it. We've seen patients recover, and we've seen patients' symptoms mitigate by using some of these particular strategies. Definitely, you want to keep your rheumatologist. Obviously, they have a lot of skills in diagnosing and assisting you. Use those medications when it's appropriate, but look at these other strategies. Lifestyle medicine is going to be the future of healthcare. We have no other choice. Everything's so expensive right now. You've got to stay as healthy as possible. The old saying is you pay now, you pay later. So you have to invest in your health. This is an investment. Invest in some of these strategies. It's worth it. Dr. Burdette, any last words of wisdom?
Do not sit and think you are stuck in place. This is not a genetic disorder. It is largely environmental, and we can shift those environmental factors in your favor.
Yeah, great advice. Thank you, Dr. Cheryl Burdette. Hey, this is Rethink My Health Radio Show. We talked about autoimmunity today. We've talked about taking action. We've given you some actionable steps when you can do certain testing, certain therapies, certain lifestyle. If you can only do one thing at a time, do the best you can with whatever you have. Something is better than nothing. Okay, you can start off by just walking an extra couple thousand steps and changing your diet. If you can't get to a food sensitivity, you can do some type of elimination. And it's so important to do something, because at Progressive Medical, which is sponsoring Rethink My Health, we know how important it is to take action. Hey, thank you so much for listening to Dr. Gez Agolli and Rethink My Health Radio Show. And remember, Proverbs 17:22, a cheerful heart is good medicine, but a crushed spirit dries the bones. God bless you. Be cheerful. Enjoy the rest of your day. And we will see you next week on Rethink My Health.